Good evening, everyone. This is Tracy Kelly again, and tonight I wanted to talk about insurance verification. So let's get started. What is insurance verification? Insurance verification is a process to verify what benefits the patient has and how much is covered under the plan. This step is sometimes considered a gray area. Once the services have been rendered and not verified, a single charge on the claim could cause the claim to deny, the entire claim to deny. The most common reason is the services did not get approved or authorized. For instance, if a patient is scheduled to have a procedure done on their left knee, and during the process of the procedure, the provider discovers an issue in another area and continues on with that procedure as well. The insurance company will not pay for that second portion because it was not authorized. It's pretty much permission to continue on to get the other issue taken care of. Well, permission has to be obtained first. So if that has not been obtained, the payer will not pay unless it's in an emergency situation. If it's an emergency, you would just have to submit the patient's chart, which consists of the provider notes and the surgical records, and that would explain the reason for the procedure. But in most cases, they will not pay for that. And I've seen a lot of services that had to be adjusted off or just not paid for. And that's a big no-no because that's just basically giving away free services, and we don't want that. So I just wanted to make sure I covered a couple of definitions, which is authorizations and pre-certifications, which is a decision by the health plan that the health care service or treatment plan for or the durable medical equipment that was used was a medical necessity. That's just pretty much obtaining permission to do so or to take the next step in the procedure. Referrals, that's a pre-approval for the health plan for the member to obtain for or from their primary care physician. That's basically getting pretty much a documentation from your primary care. If you have a HMO or POS, which is point of service, that you're being referred to a specialist to be seen. So that's the purpose of a referral. Most specialists will not schedule appointments if those referrals have not been obtained. So that's a good thing. Verifying insurance also helps in areas such as checking to see if the patient has a responsibility. For example, a copay. A copay is the patient's responsibility at the time of service, which is based on the patient's benefit plan. For example, $10 for primary care, $20 for specialists, $45 for urgent care, or $50 for ER visits. A co-insurance is a percentage in place based on the patient's benefit as well, depending on services that has been rendered. For example, you have your percentage that the patient will be responsible for after the insurance pays, for example, which will be 30%, 45%, etc. A deductible, this is also a set percentage depending on the patient's benefit plan based on the services rendered. For example, 45%, 50% after the insurance pays. This step is also important to ensure the patient's policy is active and the correct insurance information has been entered into the system for claim submission. Errors occur due to incorrect policy numbers, effective dates, group numbers, and claims mailing address. All of this information will cause a claim to deny, which we don't want that. Each payer has a specific time frame where a claim has to be received from the date of service, because within that time frame is when payment can be issued. If it's after that time frame, they will not pay. They will simply deny for untimely filing unless you can prove really, really good that it was submitted within the time frame. So that's very important as well. The importance. This is imperative for the insurance verifications department because they need to explain to the patient how we have to submit the claims and to pay and to keep them from having a medical bill. This is pretty much very important, and you want to pretty much stick to it and explain to them, listen, this is what's needed. I know that it's probably a headache to obtain, but if we don't obtain it, you could get a bill, and they don't want a bill. That's the purpose of having the insurance. So that, trust me, they're going to be frustrated, but they'll get you what you need. Most patients do not understand why their insurance will not cover any of their medical costs, and some of them refuse to pay. I've taken the initiative to fight for some patients as far as I can. I'll go ahead and give the insurance company a call and explain whatever they need explained based on the denial. And if I can't get anywhere, I'll let the patient know that they can appeal on the patient's level. And I'll submit information to them to get that ball rolling. So I really, really go above and beyond to help patients. That's just what I do, because we as the billers could easily be on the other side of that table. So I just look at it as my situation, and I handle it as if it was my situation. So that's why I love what I do. Some billing software that verifies health insurance once entered, which is awesome. It cuts down on errors. Billing software is available that automatically verifies the patient's insurance. This process eliminates the possibility of submitting claims with incorrect insurance attached. It'll give you, once you hit that submit button, it'll pretty much go ahead and think, and you'll see the little swirl going around, and it'll give you feedback. And while that patient is in front of you, that's awesome. Or you have them on the phone, and you can tell them, well, ma'am, I'm sorry, the response from your insurance company is telling me that you're not active on this data service. Is it possible you have another card, or can you give them a call and verify things are correct and give me a call direct, so that way we can make sure everything's correct on this end before we submit that claim to the insurance company. That's why that software is awesome. It really, really helps both the provider and the patient. Some of the insurance billing softwares that I have worked with that does this step is Epic, Careo, IDX, and NextGen. Very, very awesome software. And this is my conclusion of video 4. Thank you so much for your time, and stay tuned for video 5, which is titled Coding and Cross-Checking Codes. That's a very important step as well. All of this is important, but I just wanted to break it all apart in sections so I could walk you through the process of the revenue process of getting these claims, the revenue cycle process of getting these claims paid. And don't forget to click on the subscribe button at the bottom of the page on my YouTube channel. And thank you so much again. You have a great evening, and I'll see you next time. Bye-bye.